Cooperation for all agencies who are, in a phrase that we use, touching a child or a young adult, is essential, because almost every young adult that I have seen, and also myself, are what is called cross systems. Cross systems mean that this one young adult is in many different systems. When I was in child welfare, I was also in a mental health. I was seeing a mental health provider. I was also, being served for my, learning disabilities I may have had in class. It was integral for all of these pieces to be together and have the same goal for this youth or young adult.
What a lot of these agencies do is plan for the young person without the young person present. And that was me. They had this whole plan. Well, Jamal, you're gonna age out and we're gonna get you, you're gonna have an apartment and you're gonna live happily ever after. But you didn't ask me if that's what I wanted. So I really had a hard time with that. I'm like, because I was like, if there was an advocate or somebody there helping me to either funnel these questions, get some understanding, that I wouldn't have been as angry at the system as I was.
The children that we serve really needs a three-legged stool to support them. The first leg is what you would all expect. That's the attorney that handles the legal side of the case. The second leg is also fairly well known, and that's the children's services worker that's legally responsible for the safety of the child. But the third leg of the stool, the lesser known leg, is the CASA volunteer, whose primary goal is only the best interest of the child. Each agency is unique but valuable in its own way. There are a lot of very good social workers and attorneys. The child always knows they're paid professionals, government workers. A CASA volunteer is just that. They're a volunteer community person that is committed a part of their time to help these children.
I had no idea what a CASA worker was, first of all. The day that I met her, Ruth is just like this petite lady who has a commanding presence, but super, super sweet. And just from that very moment, she treated me differently than anybody else. And I felt like I had a voice. I felt heard, and I felt that somebody believed in me. The challenge is really with the collaboration with state agencies. And so I feel like the CASA relationship is extremely undervalued, and it's not even available in all 88 counties in Ohio right now. So going forward, I would love to see that their input be valued more in the courtroom and just in the care plan for the child, and that access to having a CASA be expanded so that every child can experience that and experience what I had felt, just to have someone on their side.